Beginning with the upper extremity, we have glenohumeral abduction range of motion. Begin by having your partner lying supine, arms in neutral and lying by their trunk. Palpate the acromion process. Place the axis of rotation along the anterior aspect of the acromion. The stationary arm is parallel to the thorax and the mobile arm is midline of the humerus. Instruct your partner to move arm away from their trunk and towards their head. And back down. Normal range of motion is 180 degrees. Partner's completed range of motion was 180 degrees. The plane of motion for glenohumeral abduction range of motion is along the frontal plane. For the upper extremity manual muscle test, we have the latissimus dorsi. Begin by having your partner lying prone with their arms at their side and their palms upwards. Assess available range of motion. Place your hands on the proximal wrist joint and along their forearm near their elbow. Instruct your partner to reach towards their toes and resist in the opposite direction by pulling upwards. Partner was given a 5 for this test. The muscles involved with latissimus dorsi and manual muscle test is, of course, the latissimus dorsi, the deltoid, and the incus medius. The origin of the latissimus dorsi is the spinous process of the T7 through T12 vertebrae, thoracolumbar fascia, and the iliac crest. The insertion of the latissimus dorsi is an intertubercular groove of the humerus. Actions is horizontal abduction of the glenohumeral joint. The plane of motion for the latissimus dorsi and manual muscle test is the frontal plane. Next range of motion test is a thoracolumbar flexion with tape measure. Have your partner stand and palpate for the C7-S2 spinous process. Place the flexion tape from the C7 all the way down to the S2 along the spine. Instruct your partner to flex forward and allow the tape measure to glide forward. Measure from the first initial point of the S2 to the now new point. Normal range of motion for thoracolumbar flexion with tape measure is 10 centimeters. Partner's range of motion for thoracolumbar flexion with tape measure was only 8 centimeters. Plane of motion for thoracolumbar flexion with tape measure range of motion is within the sagittal plane. Next is the oblique manual muscle test. Begin by having your partner lie supine, legs extended, and hands clasped behind their head. Have your partner curl up and as far as they can and rotate to one side. Observe how the scapula lifts off the table. Subject will be given a 5 if they are able to lift their scapula off of the table with their hands behind their head, a 4 if they are able to do so with their hands on their chest, and a 3 if they are able to do so with their arms by their side. Partner was given a 5 for the test. Muscles involved for this test is the internal and external oblique and the transverse and rectus abdominis. The origin is ribs 4 through 12 and the thoracolumbar fascia and the iliac crest. The insertion is the linea alba of the pubic crest, and the action is flexion and laterally bending of the trunk. Plane of motion for oblique manual muscle test is within the sagittal plane. Last range of motion test is knee extension. Begin by having your partner lie supine on the mat with their leg extended. Palpate for the lateral epicondyle of the femur. The axis of rotation is on the lateral epicondyle of the femur. Stationary arm is aligned on the thigh of the greater trochanter and the mobile arm aligned with the lateral malleolus. Instruct your partner to lie there while you assess their range of motion. Normal range of motion for knee extension is 0 degrees. Partner's range of motion for this test was 0 degrees. The plane of motion for knee extension is within the sagittal plane. The last manual muscle test is the quadriceps femoris. Begin by having your partner sit on the table and their feet dangling over the edge. Place one hand under the distal thigh and instruct your partner to straighten out their knee, keeping it slightly bent at a 15 to 20 degree angle. Place other hand under the proximal ankle and apply force in a downward motion. If subject is able to keep their knee straight as possible, they are given a 5. And this is what the subject did. The muscles involved with this test is the rectus femoris and the vasti muscles. The origin for this is the anterior inferior iliac spine. The insertion is the tibial tuberosity, the actions is knee extension, and the plane of motion for the quadriceps femoris manual muscle test is within the sagittal plane. These are the references for this PowerPoint.